So good afternoon, everybody, and thank you for joining us today for this important webinar. You know, self-care is important at any time, but in light of the experiences and the circumstances we've been living in the last couple months, prioritizing self-care has really become just paramount. So today we're excited to bring three incredibly engaged and internationally recognized people who are involved in working in this space, Dr. Bernadette Melnyk, Dr. Sharon Tucker, and Dr. Jackie Hoying, who will be presenting the content for today. So today, Bern is going to be laying a foundation for the presentation today, sharing some of the evidence around what's going on with self-care and the state of wellness, bringing the evidence home for us. Sharon will be engaging and sharing information about mindfulness, and Jackie on resilience, and then Bern will wrap things up and bring it home. So as we get started today, Bindu, do you have any housekeeping details that you'd like to address?
Thank you everybody for joining us. I'm Bindu Thomas, and I can manage any questions you have related to technology. So please feel free to use the chat window or the Q&A pod in order to let us know if you have any questions. All throughout the webinar, you have that option. Thank you everybody for joining us.
Thank you, Bindu. And I'm Dr. Cindy Zella, I'm the director of the academic core at the Fold, and I'll be monitoring the Q&A, the question and answer box. So please, as you have questions, put them in there, and then we'll be addressing those live at the end for everybody. So as we get kicked off, we're going to start with one of the most dynamic women I think I've ever met. Dr. Bernadette Melnyk is the founder and the executive director for the Fold Institute. So it's thanks to Bern that we're all here. She's also Vice President of Health Promotion and the Chief Wellness Officer at The Ohio State University and Dean of the College of Nursing. Bern's internationally recognized and known for her work not only in evidence-based practice, but in wellness and prevention. And so we are excited to bring Bern on to get things started today.
Thanks, Cindy. Welcome, everybody. I want to start by saying it is not selfish to take good self-care. As nurses and other clinicians, we often do a great job caring for everybody else at our own expense. So I want you to reflect today during this talk with my wonderful colleagues about how you can squeeze out, even if it's 10, 15 minutes every day, to focus on you, your health, and well-being. So evidence-based practice, which you know I'm so passionate about, plus clinician well-being equals the quadruple aim in healthcare. We will not reach this quadruple aim unless we focus on the health and well-being of our clinicians. Our state of healthcare in America is abysmal. We spend more money on healthcare than any Western world country, yet we rank 37th in health outcomes. Heart disease is still technically the leading cause of death in America. Cancer, #2. But preventable medical errors are the third leading cause of death in America. About 400 people lose their lives every year throughout the United States due to preventable medical errors, often caused by well-meaning, caring clinicians that are just burnt out, fatigued, and depressed. There has never been a more important time, especially with the added stressors of COVID-19, the tragic, senseless death of George Floyd, and all of these consequences, for us to pay attention and place more emphasis on nurse and clinician well-being. I'll never forget where I was in 2012 when I saw this media come out that highlighted a study. The headlines, U.S. physicians set good health example. Physicians in better health than nurses and employed adults. This study showed nurses had higher rates of high blood pressure, diabetes, and depression than physicians. So rates of clinician burnout, depression, even suicide are at an all-time high right now. Suicide is on the rise. If you haven't seen the February issue of Worldviews on Evidence-Based Nursing, I really encourage you to take a look at that issue. As editor of that journal, I focused the whole issue on this topic, and I highlighted a suicide longitudinal study on nurse suicide by Judy Davidson and her team. Please look at that issue. Lots of evidence-based strategies for how to deal with this problem. There are multiple causes of burnout and distress in nurses and other clinicians. The healthcare system has many responsibilities for this problem. Problems with staffing ratios, too long shifts that people work, increased clinical demands, inefficiencies with the electronic medical record. All of these are really contributing to the epidemic of burnout, depression, and suicide that we are seeing in our clinicians. We need to have an active voice for change, but we also need to take self-responsibility for what we have control over, and that is taking good self-care. So in 2017, we did a national study of about 3,000 nurses from 19 healthcare systems across the country, because I so believed that 2012 study was maybe flawed. Dishearteningly, we found even higher prevalence of medical as well as mental health conditions on the practicing nurses. We found almost 25% of these nurses from 19 health systems across the country reported depression. But The nurses who perceived they were working in an environment that supported their health and well-being had better physical and mental health outcomes. This was the first study to actually show depression was the leading cause of medical errors. Depression. So again, we've got to get so much better in our health systems, screening for depression, offering evidence-based interventions like cognitive behavior therapy-based programs in order to improve this situation, because clinician well-being is absolutely linked to quality and safety of healthcare. Like other studies reported in the literature, our study showed the longer the shift work, the poorer the mental and physical health outcomes. We must stop 12-hour shifts. We have known for years, the longer the shift work, the poorer the health of clinicians, the more medical errors that they make. How many more people will have to lose their lives because we are not taking the evidence we have now and translating it much more quickly into practice? What are we told when we get on a flight? We are told if those oxygen masks drop to put the mask on ourselves first before we put it on our children. This gets back to my opening statement. Self-care is not selfish. We have got to prioritize our own self-care so we don't get into situations where we are drained, burnt out, depressed, and even considering suicide. In 2017, the National Academy of Medicine launched a national action collaborative on clinician well-being and resilience. I am blessed to be one of the about 65 leaders working diligently on this action collaborative. If you have not gotten on the listserv for this collaborative, I'd highly encourage you to do that. A couple years ago, we published an article in the Health Affairs blog that drew a lot of attention. It was making the case for chief wellness officers throughout America's health systems. Since that article came out, we are seeing a real uptick in these positions all throughout the country. But here's what's sad. I'm in a network now of about 25 CWOs. They are all mostly physicians. I am the only nurse in this group of CWOs. Back to Florence Nightingale. She was so into health promotion and well-being. We need more nurses to step up into this arena, into these roles. We currently live in a sick care healthcare system, and that needs to shift to one of well care. I'm excited to have been appointed the first Chief Wellness Officer, not only at Ohio State, but the first at a university in the country. My charge is to improve and spearhead population health and well-being across our big, great university. This past year, the National Academy of Medicine highlighted 2 places as model exemplars of wellness. And I am so humbled to share that Ohio State was one of those 2 institutions that were highlighted for our model and our outcomes. As part of this National Action Collaborative, Jackie, Sharon, myself, and a team just published a rigorous systematic review on interventions that improve mental health, well-being, physical health, and lifestyle behaviors in physicians and nurses. Here's what we found that works. Mindfulness, which Sharon's going to talk about shortly. It works. We know that cognitive behavior therapy-based interventions work. Gratitude works. We've got to get in the habit of waking up every morning and counting 2 or 3 of our blessings. If we all would do that first thing in the morning, last thing at night, do you know how much our moods would improve? Put up gratitude boards on your units where you work. So when people come in the morning, they write down what they're grateful for. It can make a positive difference. And I don't think we use deep breathing enough. We have so many studies that show just engaging in 5 deep breaths can cut our stress response, can lower our blood pressure. Now we have to wash our hands with soap and water to prevent infection for 20 seconds. Look at that as a recovery break. And while you wash your hands, take a few really big, deep breaths. So many of you know I created a program, a CBT-based intervention, starting about 27 years ago. I targeted it first to improve depression, anxiety, stress in school-age children and in teenagers. About 17 studies later now, what we did was adapt this program for new nurse residents. And Marlene Sampson, Jackie, Cindy, myself, we tested that with new nurse residents in a randomized controlled trial. These are 2 recent publications on the outcomes. In these nurses going through this 8-session CBT program, decrease their stress, their anxiety, their depression, and improve job satisfaction. Our dream right now is to scale this intervention all throughout the country for nurses and other clinicians. We all know CBT works. Why does it work? Because it focuses on teaching people how they think directly relates to how they feel and how they behave. In CBT, we teach the ABCs. We teach people to monitor for activating events, things that are stressful, that happen around us, that cause us to have a negative thought. How to stop the negative thought, turn it around so you feel better and behave in healthier ways. So for the next 7 days, I'm going to ask you, monitor your mood. When you sense you feel stressed, depressed, or anxious, I want you to say to yourself, what was just going through my mind? And is it really true? Do I think this thinking is helpful? Do I really have evidence to back it up? You will no doubt 99% of the time say, it isn't true. There's no evidence to back it up. I have to stop this negative thinking, turn it around so I feel better. Our brains are like a computer. The more positive we put in, the more positive comes out. One of the things that can really help us to develop a more positive pattern of thinking is positive affirmations. I encourage you to do that for the next 30 days. Pick 2. Maybe I'm going to stay calm. I am healthy and strong. Say those 10 times every morning, every night. You're reprogramming your brain when you are doing this. Your brain is changing, and as a result, you're going to feel much better. The other tip that I give, just read 5 minutes every morning, every night in a positive thinking book. If you say you have no time, I say you do. You get up in the morning, you go to the bathroom, put a positive book down beside the toilet, pick up the book, start reading, good stuff going in, bad stuff coming out, and you reprogram your brain with positive for the day. So I told all of you, heart disease, technically the #1 killer. However, if you take into consideration all causes of death and disease, it's really our behaviors that are the #1 killer, including sitting is killing us. So if you're sitting right now during this webinar, I encourage you to stand. Too much sitting, even 3 hours a day, increases our cardiac risk by 30%. Sitting is also the biggest zapper of our energy. So if you want more energy, stand more, move more, sit less. Look at this slide. This is a real fitness facility in the state of California. You have a choice. You can either walk the stairs or take the escalator to go work out at the gym. A group of psychologists studied how many people during the course of an average day for a week would take the steps instead of the escalator. Only 2 people a day took the steps. This is about behavior change. Simple, but not easy. If I had to give you just one evidence-based recipe for how to decrease your chronic disease risk by this much, this is all that I would tell you to do. Physical activity, 30 minutes, 5 days a week. We have 1,140 minutes in every day. Don't you think we could just take 30, 10 minutes 3 times a day to walk around your house, to do 5 minutes of jumping jacks? Just move more and sit less. 5 fruits and veggies a day. Don't smoke. And if you drink alcohol, don't start. But if you do, limit it to 1 drink a day if you're a woman, 2 drinks a day if you're a man. Put on top of that, practicing stress reduction daily, getting 7 hours of sleep. We could knock out 80% of chronic disease in this country if we just all did those behaviors. So I want you to look at today as January 1. I want everybody on this webinar to say for the next 30 to 60 days, because it takes that long to change a behavior, establish or break a new habit. I want you to write down, because when we write it down, where we put it where we can see it every day, we're most likely to do it. Just pick one of those behaviors you want to get a little better in. Write it down, do it. And if you slip back, just get back up the next day and start again. Practice is key. It takes 30 to 60 days to change our thinking, just like changing our behaviors. So a lot of people say to me, oh, Bern, come on, in all these roles that you engage in, how do you have the time? I'll be honest with you today. I went for my 3-mile run this morning. I'm adamant about getting my exercise in every day, taking good self-care, because I lost my mother when I was 15 years of age, home alone with her. She sneezed, stroked out, and died right in front of me. I suffered from terrible post-traumatic stress disorder. But what was really sad about my mom's story, she had a history of headaches for over a year. My dad kept saying, would you go to the doctor? Well, she did. 1 week before she died, was diagnosed with high blood pressure, given a prescription for a blood pressure medication that my dad found in her purse after she died. I think you now can understand why I'm a passionate fanatic about prevention and good self-care. So if you don't do it for yourself, do it for your family, the people who love you, who want you to be around for a really long time. So with that, I get to turn it over to my wonderful colleague, Dr. Sharon Tucker.
And how about if I share my screen?
Fantastic. And while Sharon's doing that, please allow me to properly introduce her. So Sharon is a National Board Certified Psych Mental Health Advanced Practice Nurse, and she's also the Grace Sills Endowed Professorship here at Ohio State University. Sharon's Director of the Implementation Science Core at the Fold, and she's a National Board Certified Integrative Nurse Coach, as well as a facilitator for our health athlete. So Sharon, too, does a lot of work in this space. So sharing information about mindfulness, please let me turn it over then to Dr. Sharon Tucker.
I need Bernadette to stop her sharing.
Oh, I'm sorry, Sharon.
That's all right. And
There you go.
thank you. And I'll just pull this up. All righty. Make sure everybody can see it. Do you have the slides? Do you see
Yes.
the slides? Fabulous. So it is a pleasure to talk with you about my very favorite subject, which is mindfulness. I think Dr. Melnyk has already shared with us all some of the important strategies that make mindfulness really important. And so the first thing I want to do with you all is I'm going to ask you 3 questions. First one I want to ask you, well, actually, let me back up. Let me read you this quote. So this comes from Ann Barnes in the book Circus Books. And this is essentially what I'm going to be talking about. So you are not your thoughts. Do you have thoughts sometimes that overwhelm you and confuse you? Do you wish you had a button to turn off your mind? Much of our suffering comes from the fact that we think our thoughts are the core of our being. And we identify with our thoughts and allow them to dictate how we feel. So as our thoughts are often noisy and chaotic and even negative, it's no wonder we all struggle. The solution lies in not trying to get rid of your thoughts, but to stop identifying with them and stop that habit. Simply observing your thoughts without judgment and letting them go. You don't have to be a slave, none of us do, to our thoughts and feelings. What gives them fuel and makes them real is the attention we bring to them. So take away the attention, and those thoughts and feelings cease to exist. So my first question for you is, what are you doing right now? Noted. My second question is, what are you thinking about right now? And lastly, what are you feeling right now? I suspect that most of you, for numbers 1 and 2, are not the same. And therein lies the problem, and therein lies what meditation and mindfulness and awareness activities are all about, is to bring our thinking and what we're doing together. In fact, that we are half of our lives spending not paying attention to what we're doing. We're missing out on half of our lives. And I know you all know that because you can think of multiple examples of you when you wish you would have been present. And the consequences aren't just simply mistakes and misplaced objects and lost productivity, but the distraction impacts our happiness and our thriving. And we know for centuries, actually, from religious people and philosophic experts that our joy, our greatest joy, is when we're present and attentive. And happiness is here and now. And the more we place focus on that we need to be where we are right now, the happier we're going to be and the more we're going to thrive. But the problem is we are not only distracted, we are really stressed out. And in fact, in studies, we see that stress levels are increasing every year, that 1/4 of us report extreme stress, and about 1/3 of us report that our stress has increased from the previous year. And really sad statistic is that 80% of us say that we have at least one physical symptom of stress. And it's not just physical stress, it's mental health. And we know, as Dr. Melnyk pointed out in her slides, that depression, anxiety, anger, irritability, and sadness all relate back to stress. sleeping less, eating poorly, snapping at others, and not having the ability to concentrate the way you want to, all are part of our stress. So we have a problem with this, and mindfulness can help. Mindfulness has really existed for centuries out of Buddhism and the Eastern philosophies. And John Kabat-Zinn in the 1970s developed MBSR, which is mindfulness-based stress reduction. And he created this program to help people with chronic pain manage their stress, depression, anxiety, and improve their pain. And we know with 30 years of research that it actually does impact one's ability to manage their stress and their overall quality of life. And I'll say just shortly about a few other of the benefits from being more mindful and practicing awareness. And then finally, we're distracted, we're stressed out, and we're actually not very good at managing our stress. And some of the data show that about 20% of Americans say they never engage in stress management practices. Another 50% say they probably do a few times a month. And sadly, while there are people, like Dr. Melnyk mentioned, she ran this morning, there are opportunities to just connect with other people that can be really healthy. There are lots of negative coping strategies: gambling, alcohol, drugs, food addictions, internet addictions, TV addictions, and spending too much time alone. Those are all consequences that are not healthy for us. And the truth is, we've never really been taught how to manage the stress of today. You know, the whole flight or fight mechanism evolved over centuries to help us manage very serious situations of danger and threat. The problem is, in today's environment, we don't have the same threats of the past, but we have these daily kind of just insidious stressors that keep us in this stress response mode, causing us to really be in crisis mode all of the time, rather than finding stillness in our day, space in our day where we can just breathe, as Dr. Melnyk mentioned, and just find a little bit of reduction in that stress response and lower our overall biological response. So I'm going to talk a little bit more about mindfulness practices in general, and then I'm going to walk us through a just over 3-minute exercise. I want to point out to you that mindfulness is very well connected to self-compassion. And two leaders in the field include Jack Kornfield and Brene Brown, which many of you have probably read some of their books. But if you're not self-compassionate, for starters, you're going to struggle. And Kornfield says, if your compassion does not include yourself, it's incomplete. And I would submit to you, it has to start with you. If you're going to be compassionate to others, the world, and our earth. And Brene says, if you can't ask for help without self-judgment, you cannot offer help to others without judging them. So mindfulness is an evidence-based strategy for reducing stress and anxiety and bringing calm to the present moment. The data, as I mentioned with MBSR, is many other studies have been conducted with mindfulness, awareness activities, and the data are really compelling. As Dr. Melnyk pointed out in one of the 6 strategies that we discovered are healthy or evidence-based. It improves our specific markers of inflammation, cell-mediated immunity, biological aging. When we look at employees, it improves their psychological functioning. When we look at health professionals and students, we see decreased stress, anxiety, depression, and we see them improve in their ability to be mindful, their mood, self-efficacy, and empathy. We also know through multiple studies with nurses that mindfulness improves their mental health and their quality of life and productivity. We know from the chronic pain studies that patients report improved pain and depression and improved quality of life. And the good thing that substantiates this work is that we have a number of brain imaging studies now that demonstrate actual changes in the processing of the brain when one is mindful and practicing. And in fact, changes in the insula has been noted in several studies that occurs actually doing in the moment, focusing, rather than thinking of something you're not doing. So think about it as a state achieved by focusing on your own awareness at the present moment, calmly acknowledging your feelings, thoughts, and bodily sensations without judgment. And that is where a lot of people have struggles, and I'll say more about that in a minute. It's really just appreciating and being in the present moment of peace and a sense of tranquility. And it may not last very long, but every time you add it, it builds that practice that you need when you're with somebody that you want to be present with. And it's that quality or state of being, and also is something you can aim to do as life unfolds moment by moment. So there are 5 key elements to setting up a mindfulness practice. It has taken me decades, literally, to develop this practice, to cultivate it. And part of it is because I struggled with the first part, which is preparing yourself. And many people do, because we think about it being something we have to perfect, that it's a performance I need to master, and that it is good or bad. And it isn't that in any way. It is all about learning and about developing something that works for you to bring you peace and compassion and love and joy. And so it is really about establishing a practice that allows for compassion. And it allows for you to know that your mind is going to wander. Our minds will wander. And that's where people get stuck, thinking that I can't do this. I can't focus on my breath. I keep having thoughts. And be patient, because you're human and you're going to always have thoughts. And you just learn to bring yourself back. Just bring yourself back again and again and again and again, however many times it takes in whatever meditation or mindfulness exercise you have started. Bring your heart to it. Be tender about it. Bring that self-compassion so that you can tap some of your vulnerability, and you can tap some of that part of you that is hard to reach. And yet doing so is going to open up an entire practice for you and an entire way of living. And it has for me over the last probably 4 or 5 years, but I've been trying this for decades. Forgive yourself. As I mentioned with prepare yourself, there's no perfection in this. It's about trying and about learning and about just working again and again to be present in the moment. And when you fall off and you find you're not doing it, or you just want to stop in the middle of one, it's okay. Nobody's judging you. And hopefully you'll learn that it isn't about judging yourself either. It is about loving yourself. And in fact, that takes me to thanking yourself. When you take time in your day to demonstrate some care for yourself, some compassion for yourself, and also care for others, because when you do it for yourself, you're going to be much better at showing compassion for others. When you do that, thank yourself. Because as Dr. Melnyk pointed out at the very beginning of this presentation, self-care is not selfish. Self-care is necessary, and it is how we are best at creating compassion for others. And lastly, find a buddy. Some people like that. Some people want an accountability partner. Some people want that connection with other humans, and so they like that and choose to do that. But it's up to you. So I'm going to take us through a meditation here, or mindfulness activity shortly. And it's brief and it's not painful at all. But I did want to point out there are about 4 different ways of doing mindfulness activities. There's body scanning from the head to the toes. And the best way to learn this is to do guided body scanning to start, and then you can develop it yourself. There's mindful movements like yoga, where you'll bring in breath and flexibility and resistance and learn a lot about your body. There's sitting practices, which is what we're going to do right now, where you're able to just try some breath, but also be present and aware of what is you're experiencing right here in this chair. And then lastly, walking. And walking meditations, you have to be awake. You have to have your eyes open, of course. So there's more stimulation that you can notice, but it teaches you how to do it when you're encountering people in your daily existence. Okay, so I want you to get comfortable in your chair. If you're standing, I encourage you to sit. And notice your sits bone in the chair. Just notice, let the chair hold you up and just feel it. Notice your feet on the ground, connecting with earth. And I want you to imagine a string, an invisible string. I'm going to play just a little bit of music too. I want you to imagine a string from the top, the sky, running along your spine, holding you in place, vertebrae by vertebrae. And think of us as mountains that are strong despite what's going on. And I want you to notice your breath. Just notice it as you inhale through your nose, feeling your chest rise, belly filling up. And then breathing out. And as you breathe out, just notice the falling of the chest and your air leaving. And if thoughts come, which I know they do, just say to yourself, thoughts, thinking, and try to just let them float over your head. And gently go back to your breath. If you notice feelings or sensations in the body, just say to yourself, feelings, and just let it float away for now. It's normal to experience this. We're all humans. And I want you to notice sounds around you. We're being aware. Simply bring your focus again and again to your breath as you notice things around you. And you'll notice that thoughts come from nowhere and they go out just the same. But the mountain stands. And then expand a little bit of your awareness to breathing into every cell of your body. Breathe in around the spaces. And again, if you have thoughts and feelings, just notice the word, thought, feeling, and then come back to the breath. And if you notice any tension in any part of your body, especially around the neck and upper back where tension tends to accumulate, try to breathe some air into those spaces. Make them soft. Breathing in and out gently. In and out. And when you're ready, give yourself a smile. Feel your facial muscles change. And you can slowly open your eyes. I'm just going to end here with another quick quote and turn it over to Dr. Hoying. Just think about mindfulness is something you don't achieve overnight. It's a habit which you'll develop over time. The best practice is to take baby steps. Maybe just handling a door, noticing the feel of the doorknob, hear the sound of the door opening, brushing your teeth, taking coffee. But do this on a regular basis, and you'll start to see that you're doing it more and more throughout your day. So with that, I'm going to turn it over to you, Dr. Hoying.
Thanks, Sharon.
Thank you so much. And as we're transitioning the slides, please allow me to introduce Dr. Jackie Hoying to you. Jackie is an assistant professor of clinical practice here at Ohio State, and she's the director of the community core for the Fold Institute for EBP. She's also the director of MindStrong, which is a cognitive behavioral skills building program that is really focused on reducing stress and optimizing well-being. That is evolution of Dr. Melnyk's COPE program. So, Dr. Hoying, we please turn it over to you for some insight about resilience.
Thanks, Cindy. It's a pleasure to be here this afternoon and talk about if you can handle one more topic. I'm going to talk about mental resilience and how it can add to our protective factors and the 9 attributes that improve that for us. Next, please. But I'd like to start so that we're all on the same page, and I love this definition of resilience. The core strength you use to lift the load of life. So pretty powerful. We know that through science, we have some good news. We can improve our resilience, just as you have heard from previous discussion with Sharon and Bern. We can do it through growth and practice. And I'd like to spend a minute on practice, because I think as adults, we think we hear words and we should know that. And it should be an automatic thing that happens for us. But if you pause and think about anything that you're good at today, you're good at it because you practiced it. And that's what this is all about as well. So if you want to become good at it, we're going to practice it. Next, please. These are the 9 attributes that have been researched and have shown to build resiliency when you practice them. I'm going to go through each one of them and offer a tip that you can practice for that particular attribute. And I would encourage you to look at this list and identify those that perhaps you could use some additional growth in. There might be 1 or 2 that you recognize. All right. The first one's composure. So this one says that when there's disrupting life events, day-to-day events that happen, our thinking shifts from being rational to reactive. You drop your cell phone and it shatters. Right? So pause in that moment before you explode or yell or whatever it is that you would normally react. Pause and consciously think about, how do you want to respond? Perhaps there's a younger set of eyes that are watching you. Next, please. The second one is patience. A good technique to practice is active listening. This is the thought that when someone is speaking, you delay judgment about what you're hearing, and you listen to hear their words and the intent and the meaning behind those words. And you delay thinking about what you want to say next, just hearing. Optimism, staying hopeful and positive, even on tough days, right? Say to yourself, I am resilient, I am strong. And remember and focus on happier moments, because this too shall pass. Gratitude. Practice in small and big moments to feel grateful. It can be a cup of coffee, a glass of water, finishing a task. But I would ask you to focus on intentional gratitude. Intentional gratitude says this: I am grateful for my family, but take that further. I am grateful for who? Name them. Be specific. I am grateful for my dad. And then why? Why today are you grateful for them? He gives great hugs. Okay, so when it moves you to that moment where you feel a little lump in your throat or a little bit of tear starting, you have put yourself in intentional gratitude. And it is a great place to be. Handling uncertainty. Choose acceptance. Most of us love control, if we're honest, but so much of our life is out of our control. So embrace uncertainty and practice saying to yourself in the face of uncertainty, I have this, I've got it. Next one, please. Good reason to get out of bed. Have one, right? It gives you a sense of purpose. It keeps us engaged and makes it easier to be hopeful. It fills us with courage. Write it down so you can see it. It can be one thing, it can be several small things. You know that you found it when you feel inspired and happy. Be quick to let go of a grudge. Remember, I said these are ones that we may identify and want to practice. Forgiveness for loved ones and friends who will disappoint you, and there will be misunderstandings. But you have a choice. The response is yours. You can focus on the hurt, or you can focus on the forgiveness and the healing. And that lightens your hurt load. And in doing so, it gives you more joy. Satisfaction with people who are close to you. It's called connection. We know that loneliness is a lack of truly connecting with others. You don't have to have a huge cadre of connections, just a few strong relationships with people who nurture and give you hope and courage. It also boosts your physical health and your longevity. And finally, remain kind to others. Actively choose kindness. Even on days you don't feel good, do that small thing for someone else. It helps with your own coping and healing. Next, please. So build resilience, work on some attributes, take good self-care. 5 minutes every morning, Bern mentioned this, to focus on something positive, read it, meditate, practice mindfulness, and practice positive self-talk. I am calm, I am resilient, I am at peace, I'm healthy. Intentional gratitude, start a journal, practice kindness. Any of those will help build resilience. Next slide, please. And now I'm going to turn it over to Bern.
Thanks, Jackie. So Benjamin Franklin was so on target. He said an ounce of prevention is worth a pound of cure. We must, again, turn our paradigm from one focused on sick care to one of wellness and prevention. But it starts with us. There are so many things to drain us daily. Be informed, but limit your media exposure right now, because too much media exposure is not helping us. It really isn't. I hope you found, and next slide, please. I hope you found some helpful tips in this webinar to help you take better self-care. But Sharon, Jackie, Cindy, and I are calling all of us to action right now, today. Please don't leave this webinar without making a commitment to one healthy lifestyle change that we talked about on this webinar. Write it down, put it where you can see it every single day, and better yet, get an accountability partner who can ask you how you're doing on your lifestyle behavior change and encourage and support you. And last of all, really dream about what are you gonna do in the next 5 to 10 years if you know you cannot fail. Staying aligned with your dream and your purpose will improve your mood and give you great energy. So keep on dreaming, discovering, and delivering. Thank you for joining us today. Take good self-care.
Thank you so much to all of our presenters, and we're so grateful to all of you for taking time out of your busy days to join us today. We did have one question that I wanted to present to the panelists before we sign off here, and it comes from Niscom. He asks, how does self-compassion link appropriately with the resilience in each person? So who would like to take that one?
Well, I'll have an opinion, and these, I'm sure my esteemed colleagues will as well. I think self-compassion is accepting you for who you are. And the more you accept yourself and love yourself for who you are and not judge yourself for your mistakes, whatever you have done that you wish you hadn't done, things, relationship issues, whatever it might be, the more you can just learn to accept you and embrace all of you, the more likely you are going to be able to do that to others, the more likely you're going to be able to handle the stress that you will be experiencing in your life, and the more likely you're going to be resilient.
Mm-hmm. Yeah, excellent answer, Sharon. I would agree with that. I think that the self-compassion brings itself to help you with your thoughts, right? And so that you are not suffering or working on those negative mental distortions that we can get into. and that in itself can make you more resilient.
Thank you very much, ladies. Great answers. Well, with that, we've come to the time to wrap things up. But as we do, we want to remind you that the webinar was being recorded today. And so will be available to you on the FOLD website. And they've put the address in the chat. So it's fold.nursing.osu.edu. But this one, along with all of the other special COVID-19 topic webinars that we've conducted, are available to you for free. Note too that every quarter we do additional free webinars. So keep checking back at the website for information about webinars on additional topics, as well as all of the different products and services that we have to offer at the FOLD around evidence-based practice, implementation science, and implementation strategies, and academic core as well. So we hope that each of you leaves with some tips that will help make your life better, and please make it the best day of your life. Thank you so much.